Hello, my name is Anna Romero. I'm currently a junior at Carroll College and I'm majoring in health sciences. I'd like to welcome you to our Student Undergraduate Research Festival for 2021, and I hope you enjoy this research I've been conducting in my evidence-based research class. This is a systematic review of drug treatments for labor dystocia. Enjoy. So labor dystocia is defined as a condition which includes prolonged difficult labor, and this affects many pregnant women every year. Obstructed labor, to give you a scale of how big this condition is worldwide, obstructed labor, which is a subset of dystocia, occurs in 5% of all live births, resulting in about 6 million cases per year. This accounts for 2/3 of all nulliparous cesarean deliveries, and it's the reason for 50% of overall primary cesarean deliveries. Indicators of dystocia include slow progression of cervical dilation, so the cervix not dilating enough to allow the baby's head to pass through the canal, thus allowing the rest of the body to follow through. Also, inadequate contractions and pushing from the mother, so a lack of progression through the birth canal. And then poor uterine action, which results in the uterus, which is a muscle, to not be able to contract enough to give the power to push the baby and get it all the way out. Researchers recognize that there may be underlying pathophysiological reasons for this condition. As one can understand, labor is very stressful, and reasons like that and anxiety and accumulation of other factors could be resulting in prolonged or difficult labor. So a full understanding of this condition has not yet been reached. Currently, if labor does not progress within the normal rates, healthcare providers will utilize mechanical instruments such as vacuums or forceps, or drug treatments, which we will look at in this review. And then, of course, if necessary, a cesarean section will be performed. So the most common drug treatment to augment labor is oxytocin currently. Even with oxytocin, though, mothers and infants who go through a dystocic labor may end up having one or more intrapartum or postpartum complications, which may include fetal intolerance of labor or fetal distress, unplanned cesarean deliveries, which comes with its own risks, and then high lactic acid production, which indicates a buildup of lactic acid in the uterine muscle, which results in poor contractions, poor muscle contractions. Also, postpartum hemorrhaging, postpartum fevers, and ultimately, this can lead to maternal and neonatal morbidity. And of course, these issues and complications can determine the success of labor and the overall health of the infant and mother upon delivery. So recently, a new treatment, relatively new treatment, sodium bicarbonate, has been tested and research has been conducted. It is very new, but I wanted to see if that compared to the traditional use of oxytocin may result in better maternal fetal outcomes and could be a possible supplemental treatment for dystocia in the future. So that's what we're looking at in this review. The methods for this review, journal articles were collected and screened from January to March of this year. CINAHL and Google Scholar were my primary research databases. Key terms, dystocia and bicarbonate, were used for a first search, and comparatively dystocia and oxytocin were used for the second search. The results then from PubMed and CINAHL searches were compared. Ultimately, CINAHL yielded more results, more relevant articles, all lined up next to each other, 9 total. 5 more articles were then found from Google Scholar and from the bibliographies of the other 9 articles. After screening all 14 articles, 4 were excluded due to lack of access to full text for a couple of them. One was a duplicate article, another was an opinion article, so those were excluded. The remaining 10 were then analyzed, and also another was removed due to irrelevant content that wasn't supporting what we were trying to look at in this review. With the resulting 9 articles, pertinent data was extracted and compiled into a large data extraction table, which we will go into in the results section. It is important to note that in this article, in this review, dystocia refers to the abnormal rate of labor progression, which may be due to a variety of factors. In the medical field, dystocia has many different definitions depending on what the researchers or the doctors are looking at in labor. So also in the field of obstetrics, obstructed labor and shoulder dystocia, which are subsets of dystocia, are often included under the comprehensive umbrella of this condition. Obstructive labor refers to stagnated labor where the fetus is not entering the birth canal, though it is positioned favorably, whereas shoulder dystocia is stagnation of labor specifically due to the fetus being malpositioned. So it is important to note articles used in this review, some of them included obstructed labor, and those were included in the analysis. However, articles pertaining to shoulder dystocia were not. And here's a couple of my pictures for you guys to take a look at. Figure 1 on the left just depicts a woman who's experiencing labor which has stalled. And figure 2 on the right illustrates sodium bicarbonate in its solid state, which is the new treatment we will be discussing. And fun fact, it is also baking soda, so very common to us in our kitchens. So the results of this, this data extraction and analysis, first looking at the types of articles that were analyzed, 5 were randomized controlled trials, 3 were retrospective cohort studies, and 1 was a prospective cohort study. And on the levels of evidence pyramid, these are higher up on the list, indicating a higher quality of evidence and research, strengthening this review. So the first 4 articles I have listed in my references, 13 through 16, pertain to the sodium bicarbonate treatment. And it's also important to note that two of them had sodium bicarbonate administered intravenously, and 2 had sodium bicarbonate administered orally. So they were 2 different modes of administration, and that did give differing results in comparing those 2 modes of delivery. So results suggested that the oral administration of sodium bicarbonate is a more effective mode of treatment delivery, with significant differences between the control and treatment groups. Also, it's important to note that sodium bicarbonate was given in conjunction with oxytocin. And here were the results. The first article states, while maternal post-complications did not decrease, there's evidence of oral sodium bicarbonate significantly affecting intrapartum labor variables such as spontaneity of labor, need for instrumental assistance, and pH and PCO2 levels. Furthermore, postpartum neonatal complications also significantly improved. So essentially, the neonatal outcomes increased positively, and also with a mother for intrapartum labor variables. Therefore, the labor was decreased and was more spontaneous, and there was less need for instrumental assistance. And that was confirmed also in in the second article, which showed that acid-base differences at delivery were very significant between infants in control and intervention groups, with a p-value of less than 0.001. Contrastingly, the intravenous administration of sodium bicarbonate did not produce results consistent with that. For example, lactate levels were not statistically significant between the control and intervention groups. One was given a saline solution and the other was given a sodium bicarbonate solution. And no significant results between control and intervention groups concerning secondary outcomes, including postpartum hemorrhage, duration of hospital stay, and fistulae and other complications. Therefore, in that article, no causal relationships could be made. And this was also confirmed in the other article that looked at intravenous administration. And in that one, it's significant to note that it's interesting to note that the APGAR score after birth was not significantly different between the two groups. And the APGAR score indicates how well the neonate how it was affected by labor, whether it's in distress or not. So that's the 4 articles pertaining to sodium bicarbonate treatment. And then the rest of the articles are what I looked at to compare oxytocin results, which is a traditional method of treatment for dystocic labor. So those 5 articles, they had very conflicting results, which we'll get into. And it's interesting to note that some showed that there were significantly higher rates of cesarean sections, and others did not. And also maternal and fetal outcomes when utilizing oxytocin were also varied. It is important to note that the articles, the research themselves, were looking at different types of oxytocin treatments. Some gave oxytocin more frequently, others gave oxytocin, but it was compared to the relative risk of the mothers and things like that. And here's some important data, which we'll look at. In the first article here, which would be 17, reference 17, women without dystocia were confirmed to have significantly lower rates of cesarean section. However, in Rosen et al., the frequency of a cesarean section due to prolonged labor did not change. So that's one instance where there were differing results. Also, in Article 18, maternal outcomes did indicate that there are some significant differences that negatively affected the mothers, such as higher incidence of postpartum fever and hemorrhage. So that was significant in that research. And then in another article, it concluded that there was not a measurable difference between maternal and fetal outcomes between control groups, specifically in giving oxytocin every 2 hours or every 4 hours. So those are just some outcomes that, as you can see, are differing between the articles of oxytocin. So let's jump into the discussion. So obviously, this review illustrates that there are various ways to implement drug treatments during labor. Some of these articles indicated that women receive different types of care depending on their relative risk, on the healthcare policies that were in place, also which type of professional was involved in the birth of the infant, and the accessibility to treatment options. So these are all factors that are implemented upon the woman coming into the hospital or clinic setting. And each of these factors in turn affects the outcome during and after labor. So after analyzing the articles and comparing outcomes of oxytocin and sodium bicarbonate, the data indicated that oral sodium bicarbonate in conjunction with oxytocin had the most consistent results. The addition of sodium bicarbonate orally significantly impacted intrapartum outcomes and measurements, as we said, such as spontaneity of labor, need for instrumental assistance, and acid-base levels. Moreover, it's important to note that there were no detrimental effects on either the infants or mothers after the use of sodium bicarbonate treatment. And this indicates that this may be a viable source of augmenting labor, which has little to no harm on the infants and the mothers. So in conclusion, while both treatments have indicated that they beneficially impact the labor process, for example, both oxytocin and sodium bicarbonate were shown to decrease lactate levels and thereby help uterine contraction. However, there's a lack of consistency, especially with concerning oxytocin. The articles which researched the addition of oral sodium bicarbonate to pre-existing labor treatment, such as oxytocin, showed promise for future implementation. More research obviously will be conducted to verify the effectiveness of this relatively new treatment, and also to gain consistency between outcome of results. Specifically, studies that focus on the same maternal and fetal outcomes would be helpful to compare these relative outcomes, as it was harder in this review because the research showed differing results comparing different outcomes of the mothers and infants. Also, oral sodium bicarbonate seems to have the potential to drastically impact the field of obstetrics, which is really interesting and very intriguing for me as someone who wants to go into obstetrics and gynecology. And it's interesting that this could be a new progression in this field and ultimately lead to better outcomes of maternal and fetal care, as the U.S. Needs to improve that going forward. And it's exciting that this could be an option, and it's relatively cheap. As you know, baking soda is pretty cheap just for us to buy, and at a on larger scales, I could see this helping a lot more women, and hopefully bringing a new treatment option to dystocia, which is a painful process while women are going through labor. So yeah, I'm excited to see where this goes and to follow it along. I would like to thank you for joining me and for listening to my research. I would also like to thank Carroll College and the Health Sciences Department for this wonderful research opportunity, as well as Professor Schaefer, who has been tremendous in supporting me and guiding me in this research. I thank you guys for supporting Carroll College, and I hope you can enjoy the rest of the presentations as well. I hope you have a good day. Thank you.